Today's episode is going to answer all of my most frequently asked filler questions. You guys, I inject around 10 to 20 patients every single day. I am injecting filler all day, every day, and I get asked a lot of questions from you guys. So today's episode is going to do a deep dive and answer everything that you want to know. Hi, everyone. Welcome to the Perfect Dose podcast. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. Today's episode is going to answer all of my most frequently asked filler questions. You guys, I inject around 10 to 20 patients every single day. So today's episode is going to do a deep dive and answer everything that you want to know. Now, the first thing I want to mention is one of the most important things about filler is choosing the right injector. Choosing your right injector is so important, you guys. You need to be interviewing every single injector that you see and making sure they're a right fit for you. Now, something that I like to tell people is don't always go off of experience. Experience isn't the most important thing. What's actually the most important thing when choosing your injector is how often they're continuing their education. Because you could have somebody that's been injecting for 20 years, but they've only done one beginner course, and that is simply not enough. I can tell you guys that I'm a national trainer and I personally invest $10,000 or more every single year for my own personal training. So it's very important that you ask your injector, what continued education are you doing? That is how you choose the right person for you. Now, first question that I get asked every single time I see a patient that is getting filler for the first time is, will I look unnatural? So the answer is no. When you choose the right injector, you're actually going to look amazing. If you guys look at me right now, you're probably thinking, well, maybe you're not. Don't tell me if you are. But you might be thinking, well, you look really great. You don't look like you've had anything done. And that's the point. I've had probably 20 syringes of filler injected in my face, strategically spaced out over time, and I look totally natural. So looking natural with filler is all about the right placement and the right product. So oftentimes people think, well, what if I only get one syringe? Will that make me look more natural because more filler, more unnatural? And it's actually the opposite, because the more product that we can use, the more natural I can make you look. So something that I tell my patients is my job is not to put anything there that wasn't there before. And what that means is as we age, our fat pads actually deplete, or they deflate, and they descend. So when things start to fall down, filler's job is to mimic that deep fat that you once had and lift everything back up. So to answer that question, will I look unnatural? The answer is no when it's placed properly. So choose your right injector. Now, the second question that I get asked is, how much is one syringe of filler, and why can't one syringe of filler fix my whole face? Well, one syringe of filler is actually the size of a blueberry, you guys. It is a baby amount of product. So imagine a blueberry. I like to conceptualize this for people so you can actually see how much one syringe is, because one syringe looks like a lot, but when you're like, oh, it's just the size of a blueberry, it's in fact not a lot. So that is why one syringe of filler cannot fix your whole face, and it will actually make you look unnatural. Imagine cutting up a little blueberry and trying to sprinkle it around multiple areas. It's just not realistic. So in my practice, I tell patients, in order to see me, we need to do full facial balancing, full correction. That may be one syringe, pending your anatomy. It may be 5 syringes. But one syringe is actually just the size of a blueberry, so it's a very small amount. So when you're going to get filler, you don't have to be worried that getting 2 to 3 syringes is a lot. It's not. It's literally 2 to 3 blueberries that will be sprinkled around your whole face. Okay, so the next question that I get asked is, how do I avoid being overfilled? And this is a very good question because it's so important that you go to somebody that looks natural. So something I like to share is, if you look at your injector and you're like, I don't want to look like you, leave. That's not the person for you. If you look at your injector and you're like, wow, you look really great, then you're off to a great start. Now, how to avoid looking overfilled is actually pretty simple. It really doesn't have to do with the amount of filler being injected necessarily. It's all about the placement and choosing the right product for your anatomy. So what that means is, let's say you come in and your lips are very small, very thin. You come to my practice and you show me a picture of Angelina Jolie and you're like, I want my lips to look like this. Well, no, you can't. That's not possible for you. Or you will look overfilled, because if you're trying to achieve a goal that your anatomy simply doesn't allow for, it's going to look crazy. So my best advice to avoid being overfilled is to go slow, trust your injector, and make sure that your goals align with your anatomy. So sometimes you may be wanting something, but your anatomy is not going to allow for it. So I always tell my patients that if I'm telling you no, listen to me, because I make money when you say yes. So if I'm like, no, don't get filler, you probably shouldn't be getting it. The next question that I get asked often is, can I get lip filler if I don't want volume? And this is probably my favorite question, because the answer is yes. So every single type of filler, you guys, has a different personality. And a filler's personality is going to be how it looks, how it feels. So every filler is different. There's going to be plumping fillers, and then there's going to be hydrating fillers. So no, you don't have to get filler that's going to give you volume. We can choose a filler that's going to work like an internal chapstick. And who doesn't need an internal chapstick, right? Like, everybody needs that. So there are hydrating fillers, and then there are plumping fillers. And we strategically choose your filler based on your goals and also based on your anatomy. Because like I said before, maybe your goals don't align with your anatomy. And I will tell you, when you come to Perfect Dose, I will literally tell you, this is the filler that you need based on your anatomy to give you a natural outcome. Okay, the next question is, how long will my filler last and how often do I need to get it? So this is a very good question, and it really just depends on the amount of product that you get injected and also the type of product. So like I said before, filler has a personality. So you're not going to put the same personality in your cheeks and your lips. Why? Because we laugh, we smile, we talk. So we want something softer, and we kiss, right? We don't want hard in our lips. We want something softer, more natural. But in our cheeks, we need something more structural. So if you have a more structural filler that's going to be thicker, that's going to mimic your bone, like your cheekbone or your chin, that filler is going to last a lot longer than the softer filler that we're going to use when we inject something like your lips or your smile lines. So typically, I tell my patients that you can expect filler to last around a year when we're doing full facial balancing. Now, that's anywhere from 4 to 6 syringes on average. But when we're doing lips, typically you're going to get those injected once or twice a year. Now, there's something that's called the compounding effect. And what that means is the more often that you get filler, the longer it lasts. So, for example, if I'm seeing a first-time patient, you come into my chair and we do 5 syringes of filler for your first visit. I'm going to bring you back in 6 months. And at that 6-month appointment, we're going to assess your face, and we're probably going to do another 3 syringes. So you're going to be at a total of 8 syringes at that point. And because of the compounding effect, which means layering product on top of product before it's totally out of your body, you're going to have a longer lasting effect. So therefore, after your second session, I'm not going to see you for a year. And in a year, I'm going to assess your face. And maybe you don't need that same amount. Maybe we do 2 syringes. So it's all pending that compounding effect, how much product that we use. It depends on where we place the product. And it also depends on your body's metabolism, because I do have patients that I do inject their lips and 6 months later, it's like totally gone. And then I have patients that I inject their lips and 6 months later, they look perfect. They need nothing. So it does depend on your metabolism, because filler is made up of hyaluronic acid. And hyaluronic acid is naturally found in our bodies. It's like our internal moisturizer. And something that we have is something called hyaluronidase. And hyaluronidase is an enzyme in our body that everyone has that eats away our hyaluronic acid. So when we put filler that's made of hyaluronic acid, if you have a high metabolism and lots of hyaluronidase, you're going to break down that product faster. Okay, so the next question is, are there filler alternatives? And the answer to this is yes. And this is something that's super exciting, because I think there has to be a healthy blend of filler and filler alternatives to avoid looking like a filler face, to avoid looking overfilled, and to get the best possible outcome. So fillers are a gel and they're hyaluronic acid based. What we do when we inject those is we're going to inject them to contour, to add structure. So that is a filler. Now, what is a filler alternative? Well, there's something called PRP, which is your own platelet. So PRP is platelet-rich plasma. And what that is when you draw your blood, we put it in a centrifuge, which is like a device. It's a machine that's going to spin your blood around. It's going to separate your growth factors from your red blood cells. And your growth factors will make you look young and refreshed. So one filler alternative is to get injected with PRP. Now, because it's an alternative and it's not a gel, it's not as predictable as filler. So you may not get the same outcome. It may not last as long, but I love to use filler alternatives under the eyes, for example. I love injecting PRP under the eyes because you will get collagen stimulation from those growth factors that you're not going to get with filler. Now, another filler alternative that is super great is something called Sculptra. And Sculptra is really trending right now because it is what's called a biostimulator. And what that means is it's a product that's actually going to force your body to stimulate its own natural collagen. So when Sculptra is injected, it is something called PLLA, poly-L-lactic acid. I inject it into your skin, and within 3 days, that PLLA, poly-L-lactic acid, is totally gone. And you're left with like these little seedlings of collagen that are then gonna grow and sprout like trees. I'm a visual person, so I'm gonna share a lot of visuals with you guys so you understand. But think about these little seedlings growing into trees of collagen all over your face. And then because it's collagen, you're gonna see increased skin thickness. Your skin's gonna look more glowy. It's gonna look firmer, more bouncy, more tight, more elastic. Now, it's not gonna contour your face, but you're gonna look younger. So those are probably my 2 top filler alternatives for patients that are nervous about fillers, that don't want fillers at all, but still wanna do something for anti-aging. Sculptra and PRP are really, really great options. Another option for you guys that's a little bit different than Sculptra, or not a little bit, really different than Sculptra and PRP, is skin tightening treatments. So I wouldn't necessarily consider those a total filler alternative, but it is anti-aging, it is collagen stimulation, it's going to tighten your skin. So it's often a really good start for patients that are entering the aesthetic world and they're not ready for filler, they're not ready for Botox. I start them with skin tightening like Morpheus. And if you become more of an avid listener to this podcast, you will hear me talk about Morpheus all the time. It's my favorite procedure. It does make you young. Another question that I get asked, and this is from people that have already had filler or have just gotten filler, is it normal to have lumps and bumps? And the answer is yes. Immediately after injection, it is absolutely normal to have lumps and bumps after filler because it takes time for the filler to integrate into your tissue. So once the filler is integrated, it's gonna look natural. You should never look at someone and be like, oh, you've had filler. You should not be able to see it. It should be undetectable. But for up to 7 to 14 days, you may have some lumps and bumps, some bruising and swelling. It's absolutely normal to have all of this as that filler integrates with your tissue. So what I do is I send my patients home with a post-repair serum. And my post-repair serum at Perfect Dose is formulated with arnica, with bromelain, and hyaluronic acid. Arnica and bromelain help with bruising, so they're gonna help your bruises go away faster. And hyaluronic acid is going to hydrate your skin. So I will have my patients massage with the post-repair serum to help those lumps and bumps go away faster. Now, when you're massaging, you need to make sure you have clean hands because you don't want to introduce any bacteria after you've been injected into the tissue. So yes, it is normal to have some lumps and bumps, but they absolutely go away. This is most common after lip filler. So it's typically lip filler, and that's because that filler is going more superficially and it's softer and it just takes a little bit more time to integrate into all the nooks and crannies of your lips. The next question that I get asked is, how long will I be swollen and will I look crazy after filler? So I typically have 2 types of patients in my practice. I have the patients that look in the mirror when they're swollen and they're like, I look bomb, I'm obsessed. And those are the patients that are going to be wanting to come back for more because your swelling is going to go away. And then I have patients that are absolutely panicking and they're like, oh my gosh, is this going to go down? This is too much. So yes, you were swollen immediately after filler. Typically, your filler is going to go down by about 20% after injections, but it does take 7 to 14 days for the swelling to fully resolve and 3 to 4 weeks for it to fully integrate into your tissue. So what that looks like is, let's say you're coming in to see me for injectables, you get injected, the next day you're going to be bruised, you're going to be swollen. Typically by day 3 to 5, you're like, okay, this is getting better, but you're still a little bit bruised, a little bit swollen. Day 14, you look great, but you might feel filler. And then by week 4, you feel nothing. Your filler feels like your normal skin, like your normal face, and everything looks super, super great. So to answer your question, you will be swollen anywhere from 3 days to 14 days. And then at that 4-week mark, you will feel like there's no filler in your face. It will look absolutely normal. Okay. So thank you guys for tuning in. Hopefully that answers a lot of your questions surrounding filler and that you can leave here feeling more confident if you choose to get injected, that you will look natural, that you will look amazing, and that if you choose the right injector, you're in the right hands. Thank you guys for listening to today's episode on filler. Follow me on Instagram at The Perfect Dose or come see me in Scottsdale at my med spa, Perfect Dose, to find out more. This is Dr. Kristen Herzog. I will see you guys next week.